Okay. We're at the emergency room at St. Vincent's Hospital. This is a brand new facility named after Michael J. Daley. Michael J. Daley was a very special man, a man who had many talents and a Congressional Medal of Honor winner, as well as one who benefited the entire community, the longest serving on the board of directors of St. Vincent's Hospital. The president and CEO of St. Vincent's is with us here, Susan Davis, and I'll tell you, this is a very proud moment for the entire city, but certainly for St. Vincent's.
It absolutely is, David. The pride is just bursting. Words don't adequately describe how we all feel tonight. This space has been designed by our medical staff, our frontline staff, nurses, techs, and patients. And it is designed so that it will live well into the future and help us grow.
Yeah, where we're standing now is actually the entrance to trauma and critical care. Again, to our left is the 2 trauma rooms. To our right is a 6-bed critical care unit. So the ambulance would come in through an entrance to the right here, and as they stop here, there's a triage person who makes the decision. Is this somebody who needs to come directly into trauma critical care, or is this somebody who can go out to the waiting area and see the triage nurse first team triage team out there? Well, right now we're standing in one of our 2 new major trauma rooms. This room was designed to handle any type of major trauma from motor vehicle accidents, being that we're located right in between I-95 and the Merritt Parkway. We do see quite a bit of motor vehicle trauma, as well as some of the other trauma that comes in. This room was designed, it's about 3 times the size of our regular patient care rooms. It is designed to hold a large number of staff. In major trauma, you do see a large number of staff coming in, from anesthesia to trauma surgeons, respiratory care, nurses, technicians, x-ray, and so forth. And there also is a lot of equipment that needs to be held in here too. So the rooms are designed much larger. The lighting in these rooms, as you can see, is much more robust than we have in most of the other rooms. And we do set everything up also on a boom in here for a number of reasons. Because of so many people, we don't want the wires to be all over the room, people tripping over them. And we can rotate that boom around the bed as well, so we can have full access of all the vital signs as we care for the patient. We are moving as well to all electronic charting and documentation. So what we did was we built workstations right outside of the trauma room with a window viewing inside of the trauma room, so that when the patient is stabilized, assuming they are stabilized, the nurse, the physicians, the residents, who are ever caring for the patient, never really have to leave the general area of the patient. They can step out where some of the chaos is going on and get some work done and do the documentation, the ordering of the tests. We can even pull clerical help in here who they can sit, and we can get the orders done quickly and rapidly, more to serve the patient. We are fortunate enough to have a CAT scanner directly across from our trauma room now inside the emergency department, which is very rare these days. It's definitely state of the art. At that point, the decision is made. The patient goes to surgery. The patient will be admitted to the ICU. The patient, some do get discharged.
Now, as we move down the hall past the CAT scan area, which will be in service early in January, we've come to the behavioral health unit, and this is a very special and a rather unusual unit, I think.
Absolutely. This is designed to care for the behavioral health patient, designed specifically for them, and also for the safety of the staff and for the patients as well. As you can see, as you enter, there's something of a foyer here. It's a locked unit with key card access, so the staff can enter here to the left and go into the staff station, and shatterproof glass, so you can sit there and you can see, basically you have a vantage point of the whole area, the whole unit, as you're sitting there doing your work.
And right behind you, Tom, elevators.
Absolutely, yeah. This was done by design. Again, there's 2 diagnostic imaging rooms here, not the level of the CAT scan, but diagnostic imaging. The CAT scan room is just right behind the corner as well. But the elevators were put here because they lead directly upstairs to the surgical suites. If a diagnosis is made in x-ray, in CAT scan, we can take the patient, load them right into the elevator, and go directly to the operating room without any delay in services. Oftentimes, the term the critical hour has been coined in trauma, and it truly is an hour. And the quicker you can get somebody into an operating or a surgical theater to take care of their traumatic event, the more chance they have for survival. So getting them there is really important.
For most hospitals, the emergency room is the front door to the hospital. So having a front door that is patient-friendly, healing, welcoming to this community means a lot for us.
Well, as we wind down this very special unveiling of the Michael J. Daly Emergency Center and Trauma Unit here at St. Vincent's Hospital, we mark an incredible life of a man who was a great soldier, a great statesman, a wonderful friend, a very successful businessman, and humble to the nth degree, leaving a great family behind him and a tremendous tradition here at St. Vincent's Hospital that will be serving the community for many, many years to come. For DoingItLocal.com, I'm David Smith.